in today's workshop, we're going to discuss some of the ways that having bipolar is different for women than men. And most of these relate to hormones. Research has shown that for some women with bipolar, the severity of their mood episodes is affected by their menstrual cycle. And there's preliminary evidence that more women with bipolar type 2 suffer from PDD, or premenstrual dysphoric disorder, which is, you know, the sort of most extreme type of PMS. But today we're going to concentrate on other times in our lives when hormones have a huge role to play for women: pregnancy, childbirth, and menopause. And as I told you earlier, I got over my shock about being told I probably wouldn't be able to cope with having children. And I took my lithium religiously for the next 4 years, and I managed to stay well. And, you know, started training and working as a journalist, and I got married and everything. And I asked my then psychiatrist about how to approach pregnancy. And she said, I'm talking along many years ago, obviously, stop the lithium and you'll probably be fine, which of course is what I wanted to hear. And she was right, that I was fine during my pregnancy, although, you know, I stress that that's not the same for everyone by any means. But unfortunately, I definitely was not fine afterwards. It's in my case, I had a postpartum psychosis, which landed me in hospital for several weeks. And I was lucky because I didn't lose insight, you know, it wasn't a really extreme psychosis. But I started staying up all night, supposedly writing a novel, becoming increasingly elated one minute and then very irritable the next, and paranoid. And both my husband and I recognized that I needed help, and eventually I was admitted to hospital. So it took me a few months to get back to 100% after I got home. But when I was back on my lithium and stable again, and I wanted to have a second child, but this time I was determined to do some research and try to avoid getting ill. For example, I realized it had been a mistake for me, particularly, to breastfeed, because not only couldn't I take my lithium straight away after the birth, but also breastfeeding meant that I didn't get any sleep either. And we all know that sleep is so critical if you have bipolar. And so going back straight on my medication worked, and the second time, and, you know, thankfully I was fine. But following this experience, and having talked to hundreds of other women now in a similar situation through Bipolar UK and the research I've done, I've identified a few other strategies to lower your chances of getting ill. So I'm going to show you a couple of slides. I can share my screen. Oh, it's so terrible, my desktop. Hope you can't see that. Here we are. Okay, but just before I do, these are the house rules to remind you. I think you were sent these, so that just to check that what you're putting in the chat is okay for everybody. So right, so this is the first of my slides. If you're a regular visitor to the Bipolar UK website, you'll have seen these top 10 tips in one of my blogs about pregnancy. But I'm just going to run through them for those who haven't. And the first one, so important: plan ahead. So if you're able to, so which hopefully if you're in England, you are able to now, you must get to see a specialist perinatal mental health team, preferably the psychiatrist, have an appointment with a psychiatrist for preconception advice. And you're entitled to this. So do make sure that you speak to your GP or your general psychiatrist and get them to refer you. And then make full use of the appointments, because you get one for preconception advice, obviously when you're thinking about having children, and then when your pregnancy is established, you can have another one to discuss the birth and afterwards. So do take your partner or a friend or your mum or someone else to support you when you go to these appointments, but don't worry about trying to write it all down, because there'll be loads of information about, you know, medication and whether to stay on or come off, or, you know, change what you're on at the moment, or what you're going to do about breastfeeding. And, you know, it's quite a complicated conversation, but the psychiatrist will send you a very detailed account of that conversation afterwards. So don't worry too much about, you know, trying to get it all down. Number 2, be as physically healthy as you can. I'm sure that's the you know, really important, and goes without saying, really. Don't smoke, don't drink, do moderate exercise, try to eat well, take folic acid, keep your weight down, though obviously that is very hard for some people who are on medication that has made them gain weight. But equally, don't put pressure on yourself to be too perfect about that, you know, because you can't do everything. And it's not the end of the world if you don't breastfeed or if you need some extra help. Number 3, write an advanced directive or statement. This is something that, again, is on the Bipolar UK website. This is so that you can cover some of the issues that might arise if you did become unwell. So obviously we're hoping that you won't, and, you know, you're taking precautions, so you're improving your odds so that you don't become unwell. But, you know, it's still a 50% chance that you'll have some sort of episode, and about a 20 to 25% chance that you will have a postpartum psychosis. So you need to be prepared. And you can look at the blog about this on the Bipolar UK site by Tanya Gergel. And there's a video interview as well with friends of mine, Henry and Jenny, talking about how writing one of these advanced statements really helped them when Jenny had to go into a mother and baby unit after the birth of her second child. So think about doing one of those. Number 4, trying to avoid major life changes. I know this is easier said than done, but things like moving house or changing your job, you know, moving house is often on the agenda when you're thinking about getting pregnant, but, you know, it is pretty stressful. And obviously you might think, oh, I need more room because I've only got, you know, 1-bedroom flat or something like that. But, you know, it might be worth thinking about whether it's better to wait for a year or something, because, you know, the baby won't mind, you know, he or she will be in a little cot, whatever, won't necessarily need a room immediately. So, you know, think about whether that's a good thing to do or not. Number 5, minimize stress. Think about ways that maybe you can de-stress, whether that's taking more time off work in the pregnancy, if you possibly can, or practicing yoga or meditation, or, you know, whatever you find is the best way to stay calm. Number 6, prioritize sleep as much as possible. And as we all know, with bipolar, sleep is so important. But try to keep it constantly in mind when you're making decisions. For example, ask for a private room at the hospital. And if you decide to breastfeed, investigate mixed feeding and expressing, and get all the necessary sterilizing equipment ready and that kind of thing, so that you're prepared ahead of time. Number 7, don't try to be super mum. because nobody is. If you can, organise help for when you have the baby. And, you know, don't feel bad about asking for help. You know, you can't, you want to do a really good job of it. Great, that's fantastic. But you don't want to, you need people around you, and everybody needs people to help. And if you can get someone to help with the night feeds, I did that with my second pregnancy, and I got a relative came for the first 2 weeks I was home and did the night feeds, and that was fantastic. So I wouldn't hesitate if I was you. Number 8, breastfeeding. This was really a big issue for a lot of women that I interviewed for my project, because they felt quite stigmatized about not breastfeeding, you know, because there's so much emphasis on it now, and breast is best and everything, which obviously is the case. But there are some medications that you can't breastfeed on. Lithium is one of them. Quite a few others you can now, like quetiapine, and quite a few others you can breastfeed on. So, you know, that's why you need this kind of expert advice about things. But if you can't breastfeed, it's not the end of the world. And the important thing is for you to stay well so that you can, you know, look after your baby. I know that in retrospect, it would have been wiser for me to bottle feed and start on lithium immediately after my baby was born, the first one. So that's sort of a regret of mine. Might not have ended up in hospital. Number 9, try to relax and limit visitors. If you can get home as soon as you can to a more relaxing atmosphere, don't have too many visitors in the first week or two, you know, and involve your partner in that decision so that he or she can judge whether you're getting overtired or overstimulated, and can suggest to relatives and people, you know, oh, you know, can you just wait till next week or whatever, and to give you a bit of a break and time to recover and have some quiet time. And the last one, I'm repeating plan ahead, as it's so important. And it can also really help if you have done a plan and done everything you can to prepare. It helps you to feel that you're in control, and that you can feel calmer yourself and reassured that you have backup plans in place if your mood starts to be a problem, and you and your partner aren't completely thrown if it does start to be a problem. Because remember that nobody can predict what's going to happen in childbirth or afterwards, with or without bipolar. You know, you might have, lots of people have physical issues, things going wrong with the birth or whatever. So every pregnant mum really should keep an open mind, but being as prepared as possible for any contingency will make it easier to deal with whatever gets thrown at you. So as I said earlier, as women with bipolar, we're more likely to have an episode soon after childbirth, even more likely than during pregnancy. But hopefully, if you've planned ahead and you have lots of support, you'll be fine. I'm now going to look briefly at some of the other times of our lives that hormones might affect our moods. There is research on women in general showing that the menstrual cycle can affect your moods, and for women with bipolar that is amplified. So it can make your mood swings worse or even trigger a serious episode. One small study reported that 2/3 of women with bipolar 1 who were interviewed suffered mood changes due to menstruation. But unfortunately, there isn't much research on this. So Bipolar UK are calling for more to be done. And I hope that you'll support us in that by getting involved in any studies when they come up. And the other major time of life when this is an issue is around perimenopause and menopause. And again, there's a woeful lack of research on this subject, but the few studies that have been conducted show that about 20% of women with bipolar are at greater risk of a mood episode. I would say that is an underestimate, but you know, as I say, there's very little work being done on it. Scientists don't understand the biochemistry behind the interaction. And to be fair, it's a difficult thing to research because the perimenopause and the menopause can affect women at different ages. On average, though, the perimenopause starts at around 40, any time onwards from there, you know, unless you have a sort of premature early menopause. And the menopause, when a woman has not had a period for 12 months, that's the kind of definition, usually occurs in the early 50s. Most of us know about the physical symptoms of the menopause, hot flushes and headaches and night sweats, but the hormonal changes at this time can also affect your mood, and it can increase your anxiety and cause insomnia. And so all those things are particularly relevant to us as women with bipolar. Again, there's very little research on how this stage of life particularly impacts women with bipolar, but the few small studies that have been done show a potential worsening of mood episodes for many women, which, if you think about it, it's logical, because when you think about the effect of the hormonal upheaval of childbirth, you know, that has a massive effect. So it's logical, really, that, and you know, another significant change in your hormones is going to affect your mood as well. So the episodes experienced at this time are more likely to be depressive than manic, and it's important for younger women as well, you know, particularly in their late 30s, say, and early 40s, to be aware of this possibility, because hopefully many of them will be well and that at that stage, and they'll be signed off psychiatric services. They may not even realise that the perimenopause is creeping up on them. If they start to get sort of, you know, some random mood symptoms, they might not realise that that's what it could be. It could be that affecting them. But if you know that your bipolar could be aggravated in your 40s and 50s by these hormonal changes, you can watch out for signs and be ready to take action to stop it getting worse. And many women at this time think about taking hormone replacement treatment, HRT, and as a woman with bipolar, your potential vulnerability to a mood episode is important to take into consideration when you're making this decision about HRT. But unfortunately, lots of women have been put off considering it by reports of it increasing your risk of breast cancer. But those reports have been badly exaggerated, and today most certainly, but a lot of research I've seen and most experts will tell you that the benefits outweigh those risks. They're much, much smaller than people imagined in the past. So in the majority of cases, it's safe for you to take. The fact that it could guard against you having a bad episode of bipolar depression or mania is also something to think about, because that might tip the balance in favour of you deciding to have HRT. Plus, it protects you against getting osteoporosis, so has other plus points too. And when I thought about it myself, my bipolar was a major reason why I asked to have it, and I haven't regretted that decision at all. And here at Bipolar UK, we're hoping to do some Facebook Lives and blogs on menopause and other issues affecting women with bipolar, so look out for those. Now, just finally, I just thought I'd signpost you to some great resources if you're interested in these subjects to do with specifically with women, especially around pregnancy planning. First of all the blogs and videos and podcasts on our own site at bipolaruk.org, and APP, Action on Postpartum Psychosis, for anyone who's already had a postpartum psychosis and is keen to avoid having another one. or who needs more support. I also particularly recommend the leaflets on the Royal College of Psychiatrists site on perinatal mental health, and the one on bipolar actually is good. And most recently, the fantastic resources on the Tommy's Pregnancy Hub for women with serious mental illness. And the Maternal Mental Health Alliance as well has a great resources hub, and the BUMPS website is a really good, clinically reliable site for information on different medications in pregnancy. So you can look up your particular medication on that site and see, you know, it'll tell you what all the info you need to know about that. So I hope you find those useful. And now I'd like to introduce my fellow Bipolar UK ambassador and companion in this workshop, Natasha Naomi Ray, who is an actress and who's appeared in TV dramas like Coronation Street and Emmerdale. And she's the author of a book called Me, Myself and Bipolar Brenda. And very importantly, she's also a mum. So Natasha, over to you. Can you relate to some of the things that I've been talking about there? I think you're on mute. I think you're on mute. Natasha's on mute. Hello. You're on mute, Natasha. Emma, can you unmute Natasha? No. Who has to do it? Is it me?
Have I done it?
Hello. Who can take Natasha off mute? Can somebody tell me?
Sorry, I'm doing it.
Oh, come on, Alison, get it together.
That was a bit intense. Whoa, okay. Welcome to Zoom. Yeah, hi. Thanks for that introduction, Claire. Thank you. So yeah, I am a mum of a 10-year-old as of last week. I've got him to 10, which I'm very grateful for. I suppose to start from the beginning is I started very early with my mood disorder. My mum says I was around 11, 12 when I actually started. So I had my first severe episode of depression when I was 14, just before I was about to turn 15. And I took an overdose and I was in hospital. And I was under obviously psychiatric care then. So back then when I was 14, they wouldn't necessarily give you the diagnosis of bipolar. They just said I had a severe mood disorder and, you know, I was a teenager. And to be honest with you, through my teens, I felt I was just a normal teenager. But looking back through writing the book, I realised my behaviour wasn't just a normal teen. I was still obviously suffering with symptoms of bipolar. So when it became really, really severe for me, so I didn't have any knowledge that having a child, because I didn't know that I had bipolar, would affect me. My pregnancy was really intense. I was quite manic all the way through my pregnancy. I wasn't sleeping much. I was working six days. I worked right up until my due date. And then when he was born, I was still a million miles an hour. I just didn't slow down. And then I think it was when he was around 2, I started to feel really intense emotions and moods, but then I had a really, really bad low. And I just remember thinking something's just not right. And they said, oh, it could be postnatal. So then they put me on antidepressants, and that sent me into a severe hypomanic episode, which then obviously resulted in me going and getting a working diagnosis at the time, because my grandma was a manic depressive. So it actually runs in my family. So it was incredibly difficult at first. But I was very lucky because I lived with my mum, but my mum had a heart attack when my son was 3 months old. So that triggered me as well. So it was quite a difficult time up until my son probably being about 4 was when I started to find a balance. Because medication that they put me on prior to that, I've always had a very physical reaction to it. And obviously it kind of does put you off if you go on an antidepressant and you don't know you've got bipolar disorder and you have this severe out, I was like, whew, I'd gone from feeling nothing to everything, then to everything again. It was just, so yeah, I was lucky because I had my mum. I had quite a close-knit family around me. I would say that is very important. Looking back, at the time, would have had a child at 20. If I would have known I had the condition, I would have probably not at 20. I probably would have tried to work on myself and get to know the illness like I have now, understand it better, find my coping mechanisms. And then, but obviously life doesn't pan out that way. It didn't. I had to learn after I had my son. And I don't think it should put anybody off having a child. However, I do think you need a really good support network. You really, really do. And it's been difficult for me at times. My son's seen me being rushed off in an ambulance. He's seen me in a really bad psychosis where, I thought I'd caused COVID and I was dancing around for 7 hours straight. He has witnessed this. And there's nothing, he's witnessed me having anxiety attacks in the bath where I can't breathe. And so he has witnessed it. And that's the thing, you can't hide it. It's a bit like my friend's mum was diabetic when we were in primary school, and she used to have a lot of hypos, and she had she witnessed it. And it's just, that is part and parcel. You can't hide it. But what you can do, and what I've done with my son is I've tried to educate him in the best way possible. And Bipolar UK has been amazing for that. He uses a chart. He uses the mood chart. He's very aware of mental health and of bipolar disorder. He's very caring and compassionate. And I think that's so important in this day and age for young children to grow up to be like that towards people with mental health. But yeah, it's very challenging. I would say it's very challenging. It's challenging. It's the most challenging thing in my life, I think, bringing him up. But it's also been the best thing because I believe that he's been the light that's made me want to keep going and keep wanting to explore keeping myself well. And I've done that through different coping mechanisms. I really recommend exercise, especially around when I was saying to Claire, actually not so long ago, my hormones have changed, I think. And around a week before I have my period, I suffer really severe bad anxiety, which I never suffered with before. I do powerlifting, and I really feel that grounds me more so around that time as well. And I started meditating and doing Kundalini yoga in 2013, 2014. So all of this has helped me. And it's kind of the tools that I always go back to if I have an episode. And my son knows that those are the tools that help me. So, he'll know if I'm getting unwell, he'll be like, he'll come and meditate, or he'll come to the gym with me. So I involve him in the things that I do to keep me well, because, it's good for him as well. It's good for children to learn, exercise, meditation. So yeah, I mean, also, you have the kind of thing with social services as well. I'm not going to sit here and say, I've had them overly involved, because I've had family, and they have tried to help as best they can. But it generally because I have had that support network with my mum, and obviously has his dad. But it has been difficult because obviously I am a single parent, and with my mum being poorly now, she's elderly. It's a bit like I look after my mum looks after me, my son looks after me. Do you know, it's a bit of a team effort. But he's incredible. He's absolutely incredible, and I actually take no credit for him, to be honest. I just think he's been sent as a gift. I always say that, and I just think it shouldn't put people off, but definitely, you know, have that support. But and find what works for you. You know, doing Kundalini yoga doesn't work for everybody. Lifting heavy weights doesn't work for everybody. But, you know, you might find dancing, or you might find reading books or something that will work with you. Because I always say, you know, you're not your darkest days, is go and find anything, tiny bit of light, and let that, you know, and the more will come in then. And I think that's important. But diet's hugely important for me. I have to have 3 meals a day. If I don't, that can make me wobble. And I think routine, you know, is important with this illness. It is important. And I do struggle with routine because of obviously the career I'm in. It's quite an up and down career, quite an up and down industry. You never quite know what you're doing from one day to the next. So yeah, but I would say, you know, as long as you've got a good support system, it can make it a lot easier and a lot less lonely. I think it's been for me, to be honest, actually. Yeah.
Thanks, Natasha. Thanks so much for that. I mean, it's really helpful to have an insight into what it's like coping as a mum, I think. I just wanted to refer to a few questions in the chat. We've had dozens and dozens and dozens, so it's quite hard to keep track of it all.
Okay.
But we're going through them all.
Well,
Sorry, we don't need to see them all, do we? I've noted a couple.
Oh, fine. Sorry.
Yeah. I just wanted to pick up on a few people asked about lithium, and that it's not definitely 100% that you have to come off it for pregnancy. And I just wanted to reassure people that they're absolutely right. It definitely, you don't have to come off it for pregnancy anymore. It's just that my daughter's 32, so when I had her, that was the level of the research. They said that you did definitely have to come off it. But since then, you know, that research has been has been discounted as not being very good research, and they've done more research, and now the latest advice is that it has a very slight risk of increasing a heart or abnormality for the child in the first trimester only. So it's only a very slight risk, and it's a much lower risk than they thought when I was, you know, pregnant. So certainly that's the sort of thing you need to obviously go and talk to a perinatal psychiatrist about, and everybody's risk, and that those kind of decisions are really particular to you, because it's really down to your personal history, you know, how bad your episodes have been, how many episodes you've had, how many times it's landed you in hospital, how strong your family history of illness is. Because, for example, if your mother had a postpartum psychosis, or your auntie, that really increases your risk of being ill, and you know, greatly. So all that balance of, you know, the risks or the benefits of perhaps taking particular medications need to be discussed on a very individual basis. So please don't be put off. I know lots of people who have stayed on their lithium in pregnancy because that's what they needed to do to keep themselves well. And I haven't known of anybody whose baby suffered as a result. So I think that, you know, everybody's inclination is to think they can't take any medication in pregnancy, and that isn't the case at all. I mean, nearly all, most the you know, the specialist psychiatrists that I've spoken to a lot all say the important thing is for the mother to be well, because, you know, if you think about it, if you come off your medication and then you increase your risk of being ill in pregnancy, then you have to have lots more meds because you're quite seriously ill. You know, that's not good for the baby. Plus, there's a lot of research to say that if you are, for example, very depressed in pregnancy, that in itself is bad for the fetus. So, you know, if you to take the medication and you weren't depressed, that would be better. So you've got to go and discuss that with your perinatal psychiatrist, hopefully, if that's what you want to do. So I just wanted to say that one quickly because there were several comments about that. And then the other one I just wanted to say was somebody said about their premenstrual tension, and that they had that problem for many years, and then eventually they were given a diagnosis of bipolar. Well, you know, that's what we were talking about earlier on, and why we're doing this survey about diagnosis, because the average time is to get a proper diagnosis is about 10 years. So, you know, please do fill out that survey. It's coming in the next day or two to you, to your email. And, you know, if that's you who said that about not getting one because of PMS, please do put that in, because that will be very useful for us to make a note of and, you know, take forward. And the other thing was just somebody was trying to get some of the things that I put on the last slide, some of the links. Well, this whole thing is being recorded, so it'll be up on our site. That's right, isn't it, Alison? It'll be up on the site. I'm not quite sure when, but in the next few days or next week or something, this recording, so you can get that slide up again and look at it if you want to take a note of any of those things. Righto. Alison, were there some others that there was quite a lot of interest in? You're muted.
Can you hear me now?
Yeah.
Yeah, so I'll just run through. So the topic of menopause was quite a hot topic, with people asking whether, if you've always been affected by hormones, is it best to stay away from HRT?
I would say the opposite, because particularly if your illness is affected by hormones, you know, like me, like if I felt like it was worsened when I had PMS, or it definitely affected me when I had children, then that's an indication that you're probably going to be more affected when you have the menopause, because it's the changes in your hormone levels that is causing the effect of being like a trigger to your bipolar. So, you know, if you are not affected at all by PMS or pregnancy or whatever, you're less like, I would have thought, you know, it's logical that you're less likely to be affected by menopause, you know, that way around.
Thank you. And do you think bipolar is discriminated because of it's just the menopause?
Well, I suppose, yeah. I mean, I suppose you could say that. I mean, I think if you go with asking about the menopause, it's really good. You know, you're all here on this Zoom, so we obviously, you know, that there could be an interaction. So if you have a problem that you think is perimenopause or menopause, and you go to your GP or your psychiatrist and say that, then you know to say it's worsening my bipolar symptoms, or, you know, I think that this could this be the menopause, or could it be my bipolar? So that's why it's so important for us to have knowledge ourselves about things, so we can have some bit more control over it.
Okay, and then the last one on the menopause is a lot of psychiatric medication dehydrates the body, and vaginal secretions will decrease with years after the menopause. How can we treat this issue of pain and bleeding from external genitalia when gynecologists don't seem to know what to do?
Well, that's a purely menopause question. It's not really a bipolar question, because that's anyone who has the menopause that can affect. So I mean, I think, you know, if I was that person, I would Google it myself. I mean, and see, you know, or get your advice from your GP, because I'm sure there are treatments out there, you know.
Can I just say for anybody interested, because I'm talking about the menopause here, I did a live on Bipolar UK's Instagram on the 30th of June last year, I think it was, with Dr. Anise, and she's a hormone specialist at the Spire Hospital in Manchester. She's actually just wrote a book about women and the menopause, but she did the live. It's on the news feed. You know, if you scroll down the video, and it's Dr. Anise, and she does talk about hormones, the menopause and everything. Okay. And she's great if you want to contact her and ask a question. I just think that might be something that she would be able to help somebody with, because that's what she specializes in, is menopause.
Yeah, fantastic. And did she say much about the connection with bipolar then, Natasha?
I mean, yeah, she did. Yeah. I mean, it was the 20th of June. I mean, she's fantastic. The live was brilliant. It was really, really interesting. And she was like, it does obviously have a huge effect on somebody that's got bipolar compared to somebody that would just be going through the menopause, because it's a trigger. You know, I know myself, you know, with my hormones, and even certain foods I eat can trigger me. With my, you know, your hormones. So yeah, she's fantastic, and I would really recommend following her on Instagram and having a watch of that video on Bipolar UK's Instagram.
Okay. Natasha, can you say the name again? Somebody was asking.
Yeah, it's Dr. Anise. Okay. Just let me get it up. And it's Dr. Anise, and she's on Instagram. She's the hormone doc, and the live was done on the 30th of July 2020, and it's on the Instagram video. It's under the how hormones affect bipolar. Sorry, that's me drinking my water. I thought it was a double screen. Right, there's a lot slimmer there. Pre-lockdown.
Fantastic. That's great. Thanks very much, Natasha. I'm sure she knows a hell of a lot more about it than I do. I mean, I'm involved in some research that we're hoping to start, which has been delayed because of the pandemic and everything, but we're hoping to start it at the end of this year, looking at the effect of hormones on women with bipolar and depression through their life course. So when that comes up towards the end of the year, please look out for it and get involved, anybody, because we really need more research on this subject. I've got a couple of other questions here. I was just going to address: to what extent is bipolar inherited? Obviously, for those people who are thinking about getting pregnant, that's something that worries people, and sometimes there's a lot of misunderstanding, because they say the heritability is 70%, and that doesn't mean that if you have a child, the child has a 70% chance of having bipolar at all. Doesn't mean that at all. It means that if you are an identical twin, you're identical, and you have bipolar, your identical twin has a 70% chance of having bipolar. So but identical twins share all their genes, whereas obviously you don't share all your genes with your mother, because you've got half of your father's genes as well. And so your chance of your child having bipolar is between 10 and 15% chance. So, you know, you've got that's a 85 to 90% chance of your child not having bipolar. So that's the thing that's important to think about, I think. How early before I want to actually get pregnant should I start making plans and talking to someone about it? Well, I've done a few pregnancy workshops with Professor Ian Jones, who's doing a different one today, and he's an expert on bipolar and pregnancy. And he always says, when people ask him this, he says, you know, as early as possible, or, you know, preferably maybe a couple of years before, you know. So if you're thinking you want to get pregnant in your, I don't know, early 30s, think about it a couple of years ahead of that, because it can take you quite a long time to, you know, get appointments, to, if you feel you have to come off a certain medication, if you want to come off a certain medication, you might have to, you know, come off that gradually. Then you might want to try another one. For example, quite a few people I know who are on lithium, if they very, very passionate about breastfeeding and stuff, they want to try coming off their lithium, and so they switch to something like quetiapine, which doesn't have any adverse effects in pregnancy, if you know, for people who can tolerate it. I know some people it makes them not feel very well, but quetiapine is something that you can take through pregnancy and breastfeeding with no effects on the baby. So, and most things you can. I can't quite remember. Lithium is, you know, as I say, some people take it in pregnancy and with no ill effects, and it's certainly not the no-no that it used to be considered. But other medications, antipsychotics and stuff, are generally, people can take them. So why do bipolar meds cause such weight gain? I think that the general consensus is that this is related to hormones to some extent, because, you know, hormones are quite linked up with metabolism, but it is an area that the medical profession and the research community just don't really know enough about. They don't really know why they cause such weight gain, but I do think it's something that in psychiatric research is not given enough attention, because I think, you know, there aren't that many women in psychiatric research here, and the funders and everything, if you put in to try and do studies about this, they're not really interested, because they think, oh, that's, you know, why does it matter that you put on some weight gain? I don't think it's appreciated how much it affects people, you know, both their health physically and mentally, if they put on a lot of weight because of their medication. Yeah. Anything else, Alison?
Yes. There was a question about preventing triggers that are caused by pregnancy. I didn't know if that's a common thing or not.
I don't quite know what you mean by that.
I think it's a really difficult thing to answer, actually, to prevent a trigger with pregnancy. I mean, even when I look back and I think, could I have prevented, you know, that manic behavior when I was pregnant? I think it's really difficult, because I think you have to become aware. You have to know what your triggers are, don't you? So if you've not been pregnant before, you're not going to really know what's going to maybe trigger you.
No, I mean, I think the big thing as well is that if you have bipolar, it's the birth itself that is the biggest trigger. You know, a lot of people will suffer some symptoms during pregnancy, but it's generally the huge upheaval, you know, and the drop in progesterone particularly seems to be but they don't know how or why triggers this reaction, because most people with bipolar have an episode within days of giving birth. So so you can see that it's, you know, it's something that's happening in your body, and it's not as if, you know, obviously this lack of sleep doesn't help, and some people think that if they've had a very, say, a traumatic birth that has gone on for, you know, 2 days and 2 nights or something, and they've had no sleep, obviously that's not going to help. But you know, some people have not a very long birth, not a huge amount of loss of sleep, and yet they still have that reaction. So it's very well established that childbirth itself is a trigger. I'm sorry, there's so many others. There's absolutely hundreds of questions in here, but we just can't get through them all. But I'll have a good look through them all, and I'll try and do a blog on the Bipolar website and address some of the others. And please fill in the survey and put in that any relevant things as well, particularly the ones about diagnosis and things. So I think that's probably all we can manage today, as we're almost at 3 o'clock. But I hope it's been a little bit useful. And do anyone who wants to contact me personally about anything, just write into the office and they'll pass on the email. I'm very happy to try and help, but I'm not a medical doctor. I'm only a PhD, so I can't answer medical questions. But thanks for coming, everybody, and I hope you enjoy the rest of the conference.